Good afternoon and welcome to the COVID-19 Military Support Town Hall hosted by the COVID-19 Military Support Initiative. This is an initiative being organized by the Association of Defense Communities and Blue Star Families. My name is Tim Ford. I'm the CEO of ADC, and I'm joined today by my counterpart at Blue Star Families, Kathy Roth-Duquette. Good afternoon, Kathy.
Hi, Tim.
Welcome. We'll get back to Kathy in a second. I wanted to just spend a few minutes framing out our discussion today and what we're looking at doing in this initiative. Our nation and our world is facing a crisis like we've never seen in 100 years. It's impacting the lives of everyone. It's a public health crisis, but it's also a human one. And our sympathy and thoughts go out to everyone who's lost a family member or is dealing with the health impacts of this crisis. We're all in this together, but all of us on this call today understand the unique impact this crisis will have on our military and our military families. The men and women who protect this country can't work remotely, can't necessarily self-quarantine or practice social distancing. They must do their jobs while still worrying about the same things every American is worried about: their health, their family, and the economy. And all of this has dramatically changed in just a matter of weeks. Our national security depends on it, and that's why both Blue Star Families and ADC felt it was critical that we create a platform for bringing together everyone who plays a role in supporting our military and our military families, and to make sure we're doing everything we can to navigate this crisis and emerge stronger. The Association of Defense Communities and Blue Star Families and the participants from the White Oak Collaborative are joining forces to create a united national platform for sharing information, maintaining engagement, developing promising practices, and policy approaches to ensure our military receives the support it deserves. Over the next few months, you'll see a variety of activities coming out from this initiative, including comprehensive coverage in a daily publication that builds on ADC's widely read on-base newsletter. We'll be hosting a variety of town halls like this one, where we'll talk about the key issues facing our military, our defense communities, and our military families. And we'll be convening military community and family organizations and the experts from those organizations to identify and advance promising practices that need to be implemented quickly to support our military and our military communities. And we'll be pulling resources together and documenting promising practices and making those resources available to everyone on a new website. This entire project has been developed and launched in less than a week, so we're still developing some components, but our website is now live at www.defensecommunities.org/COVID-19. We'll have that slide up so you can see the website, and we'll be sending that link out to everyone after today's call. Everything we are offering as part of this initiative is going to be free, and we are really opening it to anyone who is looking to support the military during this crisis. And we are pulling the significant resources of both Blue Star Families and ADC to make this initiative possible. And we are also talking with the generous companies and foundations who support this community to identify a way to resource our efforts and the assistance we can provide to all of you. With that, I would like to welcome back Kathy for a few words and some of the work that Blue Star Families is already gearing up during this crisis. Welcome back, Kathy.
Thanks so much, Tim. I want to thank the 1,000 people who are joining us on this call today. This phenomenal response, given perhaps the 2 days notice we gave people, is an indication of the need and the benefit for this effort that we're providing. Many folks got turned away from this town hall today. ADC and we will work on enlarging the capacity of the town halls in the future. We'll also look to provide more visual content for the speakers as well. I am really grateful for ADC's leadership and partnership here, and for this entire extraordinary community. Dozens of leading organizations have joined together to help us consolidate an entry point for military families, nonprofits, community organizations, and others in this community of interest that includes philanthropies and for-profit companies who all want to help understand how we can best support all the components of our military connected community during this time. The landing page is very much a work in progress. We will be sharing on that page in the future the logos and links to our partner organizations who are involved with this as well. And we look forward to collecting those from you, our partners who are on this call. We'll be hearing from more of these partnering organizations in future town halls, as well as from our government and military service partners, many of whom are also on this call. We have an extraordinary community of goodwill to draw on in this effort, and this is something I'm really grateful for. I spoke to our partners in the Office of the Secretary of Defense, who are also participants on this call, and they will be providing us the best links to the Department of Defense best information, which we will post and lead with on the site. We want to make sure that we are well coordinated with all official voices. Finally, I want to note that Blue Star Families is collecting feedback from military families in a military family pain point poll. So we can catalog in real time, over time, what military families are experiencing on the ground and raise those issues for resolution as we identify them. We're going to ask all of you on this call, as appropriate, to help us push this survey out to get the broadest possible insight into the challenges. The survey is localized, so we can understand local challenges as well. It's a living survey. We welcome your recommendations on making it more relevant. We'll be sending that to each of you directly afterwards. So back to you now, Tim.
Thanks, Kathy. Before we welcome our first speaker, let me remind you that this is an interactive discussion. If you logged onto the meeting platform, you'll have the ability to ask questions through that platform. If you're just on the phone, please feel free to email your questions to info@defensecommunities.org, and they'll be sharing with us, those of us who are moderating the sessions, and we'll try to get to as many questions as possible. Before we get started, I want to take a quick opportunity to thank the amazing team at ADC and Blue Star Families who are working literally in every corner of the country right now, but have come together as one team to make sure this event is possible and that we are starting to roll out some great work. Let's move on to our first speaker, and that is Brian Bender, a senior national correspondent with Politico, where he focuses on Pentagon, NASA, and defense aerospace industries. He was previously the national security reporter for the Boston Globe, where he has covered military operations in the Middle East, Asia, Latin America, and the Balkans. I know many of us have been following his COVID-19 coverage over the last couple of weeks, where he's been doing some great reporting on this topic and what it all means to the military. I want to make sure Brian is with us. Brian, are you there? I think we lost Brian for a second there. If you want to just hold on, we're going to see if we can get him back connected. Brian, are you there?
Okay, I think that worked.
Sorry about that. Well, welcome. Yes, we can hear you.
That's okay. That's okay.
Yeah.
Sorry, I'm a few minutes late, but the VA secretary called.
Well, that takes precedent, you know. Well, welcome and thank you for joining us today. I wanted to start with you because you've been covering the story from a perspective of a reporter and covering DoD. Let me just start, and you know, how have you seen the military response to this pandemic evolve, and where do you see it going?
Well, you know, I think like the entire federal response, what we've seen is an evolution by the day, and maybe even a revolution. And by that, I mean, if you go back a week or 10 days from now, I don't think that DoD or other federal agencies were on a war footing, but I think they are now in a very real way. And you've seen that in a bunch of ways. Number one, the National Guard in individual states have been activated in growing numbers into the thousands, and that's expected to grow. That's been at the request of the governors in particular. The Guard has not been federalized, so it's not been called up by the president yet. And it sounds like from what the Pentagon was saying today, they're not planning to do that. They think the better way to do it is to allow states to figure out what they need, where they need it, and then if they need additional Guard resources, then maybe they can sort of go to another level where they could pull from other states. So the National Guard is one. The military, the Pentagon has also made available, at least so far, I think, 1 million respiratory masks, and I think that's going to go up to 5 million. They come from a strategic stockpile of medical supplies that the military has. So the Pentagon's been providing that to the Department of Health and Human Services, which then figures out where in the country those kinds of supplies are most needed. We've seen over the last couple of days the Navy's 2 hospital ships, the Mercy and the Comfort, are both being deployed, one to New York Harbor, one to Seattle, both 2 hard-hit areas. And then also just the military logistics, I think, has played a significant role here. For example, the Air Force flew, I think, 500,000 test swabs from Italy to Memphis, Tennessee, to the FedEx facility there, where it can then be, portioned out to places in the country where they're needed. So the military is doing what it can more and more every day. But I think, obviously there are some limits to what the Pentagon can do. The Pentagon is not necessarily designed for, dealing with a national medical crisis like this, but certainly it has some medical capabilities, supplies, field hospitals, that sort of thing that can supplement the broader medical system. So I think that's kind of in a nutshell, what we've seen the military doing. That doesn't get into what the military is doing to protect its own people, though, which is maybe something we can get to.
Great. Well, maybe tell us a little, as there's been a lot of discussion about what the military might do. And I know that mayors and governors and others have been talking about that. But where do you see this going? I mean, where do you see potentially the military's role as we move forward on this? And what are those pressure points that you see folks potentially hitting?
Well, I think going forward, I think there's no doubt that you'll see the military's kind of organizational and logistical role increase. In other words, supporting other federal agencies like HHS, like FEMA, and getting things to the places where they're needed, potentially, housing people that might be ill. We've seen that already. For example, I think 3 military bases, Air Force bases, were used to quarantine some of the cruise ship passengers that had been infected or had been exposed, and they were concerned they might be infected. But I think everyone we've talked to has said there's a lot the military can do, but there are limits to it. Again, logistics, getting things where they need to be, perhaps dipping into some of those strategic stockpiles of equipment, as the military has already done in the medical supply case. But we don't want to get to a point, most people will tell me, where the military is somehow policing quarantines and out on the streets and playing a law enforcement role. I think that's definitely something we don't want. Nobody wants. And quite frankly, the military is not really geared towards, that sort of role. There are legal prohibitions against some of that, but also it's just not something the military is trained for. We hopefully can manage the crisis in a way that states and localities and those local law enforcement agencies are doing the most. I think on the medical side, the military probably will do more as well. I mentioned the hospital ships. Those are not really designed for infectious disease, but I think where they can come in handy is to offload some of the pressure on some of the hospitals in some of these hardest hit cities. So in other words, they're dealing with a lot of coronavirus patients. Maybe they can send some other patients that need some general care, off to these hospital ships or to other military medical facilities that they might set up as sort of supplementary. In other words, not treat the virus, but treat other things so that the medical system can focus on the virus.
Great. While this crisis is consuming the world's attention, the military must still carry out its mission and training and operations around the world. Is that possible? And what do you think is going to happen? I mean, what are the risks and what are the possible changes we'll see in the coming weeks and months?
Well, that's one side of the ledger where we've also seen a lot of activity and a lot of changes, quite frankly. Just like the rest of us are, you know, staying off the streets, staying out of large public gatherings, engaging in this social distancing. So is the military. They've taken a lot of aggressive steps in recent days, canceling, boot camp graduation ceremonies. They let the Air Force Academy Cadet Corps go home early, effectively, except for the senior class, so they can focus on getting them graduated on time. Training exercises all over the world have been either canceled or curtailed, particularly in some of the areas of the world like Europe, where the virus has been spreading so rapidly. Testing personnel, quarantining personnel that do get the virus, and hopefully, the military is a pretty young, healthy force compared to the public at large. They can weather this, even if a good number of them get sick. So, the military has been taking drastic measures to, just like the rest of us, to limit the spread of the virus so that it doesn't infect, if you will, military readiness, military preparedness, because obviously we want the military to be ready and able to do its main mission, which is to defend the country against potential threats out there. So, I think we're seeing a lot, and we're going to see more of that in the coming days as I think the military gets more cases. I think as of yesterday, we had some 50 cases of military personnel who have the virus. That's going to grow, presumably, just like it's going to grow in the general public. I think an interesting case study to look at on this subject is what General Abrams has done, Army General Abrams, who's head of U.S. forces in Korea. As we've known from the news report, South Korea has been pretty hit hard, but also aggressively combating the virus. And one of those things is the U.S. military on the peninsula and families, because dependents also often move to Korea for a couple of years with the military family member, taking aggressive actions to quarantine, lock down the military and their families to make sure the virus does not infect, the 20-some thousand U.S. military personnel that are there. And from all accounts, they've been pretty successful in doing that, in limiting the spread of the virus.
Brian, we're getting a question in from several folks about testing, and I know that has been the theme of a lot of discussions at the federal level. What have you been seeing and hearing about testing for our military service members? Is that something on the table, or is that sort of in the whole sort of confusion and debate about testing overall?
Yeah, I think it's all part of this larger challenge, which is how do we get more test kits? How do we get a better sense, quite frankly, of how many people are getting sick and have this, or maybe have already had it and didn't know it? And I think the military is, quite frankly, in the same pickle, if you will, that the rest of us are in, which is a very limited supply. They're trying desperately to ramp up that supply. As I mentioned earlier, the military has even been transporting some of these test kits and the swabs that they use for them to try and bulk up the supplies for all of us here in the United States. And that also, raises the question of military personnel overseas. How do they get tested? Are there enough, test kits? We heard some anecdotal reports from Afghanistan, for example, at a relatively remote outpost where some soldiers were exhibiting some symptoms but couldn't get tested, and I think eventually they were tested, but the test swabs themselves had to be flown back to Germany where they could be analyzed before they could actually get answers. And it turns out that the good news is that none of those personnel were sick. But the testing question is a perennial one, and it's affecting the military, it's affecting the public at large. And hopefully, as the Trump administration has said, in the coming weeks, we're going to ramp that up pretty significantly, because we don't really have a good sense of how widespread this is until everybody pretty much can walk into their urgent care or to that military hospital and get tested, and like they could for the flu.
Thank you. This has been an incredible story to cover, I'm sure, as a reporter. What is for you been the most interesting thing, and what are the storylines you're following right now as you track this moving forward?
Well, maybe I'll take the second part first. So I've been tracking, what the military's been doing, both internally to protect its force, and also what it's doing to try and supplement the national emergency. I mentioned earlier that I had interviewed the VA secretary today, obviously by phone. Normally we would do something like that in person, but that obviously wasn't advisable in this case. So talking to the VA, because they also have a role as a sort of an emergency response role in a instance like this, where they are preparing to deploy, if needed, several thousand doctors, nurses, other medical personnel if the civilian authorities need them. But they're also obviously very engaged in protecting the several million people that are in the VA health system, many of which obviously are very up in age or elderly or in that demographic that could get particularly sick in this case. So those are some of the things I've been tracking. As far as how different this is, I think one thing that's very different is Politico is now a completely virtual news organization, almost exclusively. We're all working at home. Our newsroom in Arlington, Virginia is empty. And, it takes some getting used to. But one takeaway that surprised me a little bit is I think our level of cooperation and working together is actually improved in the last week or so since we've been working remotely, even more so than when we're all physically in the same big newsroom. And I'm not sure why that is. Maybe that's technology. Maybe that's sort of we're all sitting in our home office alone and we want to engage more with our colleagues. But that's just an example of, I think, sort of a positive in all of this. But definitely an interesting time to be a journalist, to be an American. I feel like in many ways there's opportunities here if we can get through this. We're being tested. There's no doubt about it. No pun intended. And hopefully we'll pass the test.
Well, thank you, Brian, for joining us today, and we'll be looking for your continued coverage on this story as it moves forward. I'm going to turn it. Thank you, Brian. I'm going to turn it back over to Kathy, who's going to introduce our next guest.
Thank you, Tim. I'm very excited to introduce Brianna Keilar, anchor of CNN Right Now and author of Homefront, a column that focuses on military families. Brianna is a military spouse herself and a great friend to Blue Star Families and many other organizations that seek to support military families in the military community. Brianna, thank you so much for joining us today.
Yeah, thank you so much, Kathy, for having me.
So you've spent weeks on the front lines of this story, talking to experts and political leaders. So I know perspective is hard for all of us at this moment, but perhaps you can help give us a sense of where you see this story today and what you think it means for the country.
For me, it sort of feels like all of a sudden this is like crept up on all of us here just in the last few days because it's affecting our lives now. But talking to doctors and, epidemiologists and folks who are trying to develop vaccines and everything, they've been watching this as it originated in China and started to spread. And they sort of describe it as this pandemic coming at us in slow motion. And it's sort of one of those things where people, you just don't take as much notice until something is really affecting you. And I think where we are right now is that it's kind of just starting to get difficult and it's going to get worse. One of the things that we've been focusing on, and I don't entirely have like a bad news, negative perspective to share today. I actually have some positive stuff to share, so bear with me while I get to that. But there's a report out from HHS that talks about how we could see waves of this coming over the next 18 months. And right now, it just seems like the government is a little behind the 8 ball, and they're throwing a lot of stuff at the wall, trying to get things going in terms of different kind of treatments or stuff that's going to mitigate symptoms even as they wait for a vaccine. But it's, you know, it's tough. The way I see it right now, and I think the thing that just bothers me in terms of or worries me, I should say, in terms of like what's very real and what we're all feeling right now, is that we hear officials and experts kind of describing how we're on this war footing. But I think one of the things that I've been thinking a lot about, and certainly not to minimize the sacrifice in any war, but one of the things about being on a war footing that's actually made it possible, I think, in the past, or made it less bad, has been that people have been able to band together and connect. I mean, thank God for technology, and we have that. But as you all know, it's not the same as seeing your friends. It's not the same as hugging your friends. It's not the same as being face to face with people, going to work, having that normalcy. And, you know, one of the things that I sort of worry about is the element of this being a war footing, but this potential for isolation, especially for people who already might be a little bit isolated. I think that's something that military families can really connect with. They've done a really good job, a lot of them, building up their online networks so they can kind of lean on that. But I sort of worry what that means for everyone being closed off to each other, because I think it's just one of the most important needs that we have as humans.
I think that's a great point. And when we think about some of the work we want to do on this platform and together, I think certainly, you know, promising practices for fighting that isolation and for creating that connection is one of them. As you mentioned, there's an added, everyone's touched by this crisis, but for people in the military, there are added pressures. Both the fact that, you know, in our Blue Star Family Survey, we see that nearly half of families start out feeling isolated. You know, they're far from family and friends, and they're in communities where they don't necessarily feel they belong in the first place. And then we add this on top of it, then added to the fact that national security can't be done remotely or be delayed, that we are expecting this to increase the role that the military can play. How do you see military families becoming more impacted over time?
Well, okay, so here in the near term, I mean, there's just so many ways that we're hearing, right? There's some families, it's this busy time of year, people are PCSing, they've already they've shipped all their household goods, and now they're stuck in limbo. Where's their stuff? Are they homeless? How long is that going to last for? You know, there's actually a significant fraction of military families who rely on free and reduced lunches, more than you would think. And without having that, you've got this issue of food insecurity for military families. Where is that? You know, some bases, near some bases, depending on where you are, you're going to have more resources than others. What about those folks who don't have the resources to kind of mitigate the effects of the loss of the meals? Finances. You know, in the near term, you've got these like out-of-pocket expenses as you try to deal with this stuff, especially if you've been trying to PCS, or if you were expecting that you were going to PCS. And then mental health. I think all of us are experiencing anxiety. And if you already have sort of underlying anxiety or depression, this can hit you in a very difficult way. This can obviously make things more difficult. So, I mean, those are just some of the concerns that I have. I see this is I was talking about, I have some sort of positivity in my message today. And one of the things that I would say is one way that military families can look at this is that, I mean, I personally think, and I'm a relatively new military spouse, but my husband's gone on 2 deployments since we've been married in the last few years. I feel more prepared for this because of what I've been through with deployments and being a military spouse. And so I'm now looking around at people and seeing that I think they're not as used to having some of those emotions and those feelings that we have as military families. So I think there's actually a way, I think finding purpose in what we're going through and helping each other is one way to really mitigate the effects and the isolation here. And don't underestimate that as a military family, you have a lot to share actually with your civilian community members on how to get through this. For some military families, this is going to become increasingly difficult because it makes their current circumstances, maybe their loved one, you know, is deployed, now they find themselves out of work, or they find themselves without some of the resources they normally rely on. This could be the thing that kind of is like pushing them towards that breaking point, right? Then there's some military spouses where the travel ban might mean that your spouse isn't going to training, and you're actually going to have them around when you thought you wouldn't, and that's going to be more helpful for you dealing with this in the near term. So there's, I think kind of, it's just very complex, and it really depends on where you are as a family and what moment in time you are. And the other thing to consider is we're also seeing more young people who are getting sick. So I think we really have this sense that like the military was immune from this, and it means that we have to be very careful. It means that we have to act like, you got to act like you have it. You got to act like people you're dealing with have it. I think of when I had our baby and he was a newborn, I was very careful about kind of who was coming into the house, and I'm not just going to hand him over without someone washing their hands, or if they've got a cough, they're not getting near him. It's kind of like that. All of the lives that we have around us are so precious, and we really have to be very careful about it.
Yeah, I think those are all really great points. And I think being able to elevate them and share them is really meaningful. I know personally, I have to say it means a lot to me to have someone in the position you're in, to be able to have that firsthand knowledge and be able to share it. I think you make great points about the strengths our community can share with the larger community in terms of how do we get through tough times? How do we handle separation? So I'd love us to follow up on that. I know we have some questions from the audience. So Tim, can I turn it over to you for those?
Yeah, absolutely, Kathy. We're getting amazing questions coming in, some very specific questions, and some of those we can't necessarily answer today, but this will help us in terms of some events we'll hold next week. I know people have questions on PCSing and things like that. But for Brianna, I think there's a question that came up that I think a lot of us have been thinking about is, what is the best way to get good information on what's happening? We're hearing on our bases that there's a lot of misleading information being shared. And, you're a reporter, you're there to help us understand what's happening. What are your recommendations in terms of how folks in the field can really understand what's happening and get the right information?
I am looking, I know on, for instance, CNN.com and other national news organizations as well, you can go and they're kind of giving you the very latest. But I don't know about you guys, I wake up in the morning and I have whiplash, right? The number of cases that have changed, and it just feels like I've never had the feeling. It happens every now and then where I wake up and feel like, wow, a lot changed overnight. I feel that way now every morning when I wake up. I am a news person who's sort of more used to that. I am overwhelmed by that. So I think just accept the fact that you're overwhelmed and you're looking for information. One of the places I'm looking right now, actually at the CDC.gov coronavirus. So if you go to CDC.gov, they will tell you, the first thing I see is guidelines. It says the president's coronavirus guidelines for America, 15 days to slow the spread of coronavirus. So you can see the latest recommendations about how you do this, how to protect yourself if you think you are sick. I mean, I myself was thinking, we just had allergies come out here, and I thought, well, I'm pretty sure it's just allergies, but what if I think it's this? I want to think ahead about what I'm going to do. Okay, so I call my doctor. Will tell you, like, talking to people, it seems like you have to be prepared for some trial and error. You call your doctor, they tell you to call, the public health department. That seems to be very overtaxed right now. But this will tell you about symptoms, older adults and medical conditions, how to prepare your family. And then, I do think, like, you want to find kind of the news organization that works for you. CNN.com, I feel like we've been doing a really good job putting out information. Politico as well. You can look at these news organizations and they'll tell you the latest. And if you just want to know what the latest say coming out of Washington today, the president's talking about a possible treatment and using like a malaria drug. There's questions about whether that's going to work. You can see that. You can see lessons from China. So if you wanted sort of have a look into the future, you want to see what the lessons from China are. And that's something I do know right now that it's sort of, and it's a little bit unavoidable, that there feels like there's this information overload. But what I would caution people on is that there's a lot of disinformation out there. I've had family members call me and say, or not call me or text me, and they'll send me like, look, this is the test. You breathe in and hold your breath for 10 seconds. And this is what Japanese experts or Stanford scientists are saying is the way to self-test for coronavirus when you can't actually get in for a test. That's not true. It's not true. I mean, I think there's something important to make sure you don't have fever, to make sure you're not coughing, to keep washing your hands. How are you feeling? Can you breathe? Obviously all of those things are important, but there's stuff out there that is not true. So if you're not seeing it, having been the process that this stuff goes through to be on the New York Times or Wall Street Journal or the Washington Post or Politico or CNN.com, the fact checking is rigorous, and we're getting that from doctors. We're getting that from verified experts. And you don't want to just be grabbing something that sort of looks legit, but you can't really tell where it's from. You really do not want to do that. Be very careful of that.
Yeah, thanks, Brianna. And I think that points out exactly what we're trying to do with the landing page on COVID military, on the COVID military support initiative. We're going to try to put together the most vetted, reliable organization related to the military community and military families, including DoD, installation resources, links to our partners. And we seek to be that reliable site for folks that is both private and nonprofit or community organization, and so on. Brianna, thank you.
I do think that is so wonderful, Kathy, because there are different needs for this community. I know, I have some of them as well. And I just think that's really fabulous to have a place where, military families and military connected folks can go and know where to get the right information about their situations.
Thank you. And as we get these questions, we'll post, the popular questions and answers to them on that site too, so people can kind of get a running list of facts. Frequently asked questions, we'll be sending them out to government and other nonprofit partners to triage the right answers. So we hope to be able to build confidence. Thank you again, Brianna, for joining us.
Thank you.
Tim, I turn it back to you.
Thanks, Kathy, and thanks, Brianna, for joining us today. Again, as Kathy said, we're getting some great questions in. We are organizing all of them, and they really will help us frame out future discussions we're going to have as this process moves forward. But I want to welcome our next two guests to the town hall. And both of them are going to give us their perspective and insight from their own experience and work in defense policy and national security. I'm pleased to welcome Mark Cancian, the Senior Advisor, International Security Program at the Center for Strategic and International Studies, and Michael O'Hanlon, Senior Fellow and Director of Research in Foreign Policies from the Brookings Institute. Welcome, Mark and Michael. Are you both there?
Yes, nice to be with you, Mike.
Hey, welcome both. It's always a little nerve-wracking on these platforms to make sure we have our folks there, so I'm glad you're able to join us. You are both well-regarded observers and experts on national security issues in the military. I wanted to start just by asking both of you, as you look at this crisis, what is your biggest concern about its impact on the military? Maybe I'll start with you, Mark.
Well, we're already seeing some degradation in readiness as exercises are canceled and deployments are canceled, and I think that's going to continue. I think all worldwide exercises are going to be at least scaled back, if not actually canceled, and you're starting to see, for example, Navy ships that don't rotate. The thing I worry about, though, is the next level of degradation. For example, the services are not allowing families to come to boot camp graduations, but if the services get to the point where they actually have to cancel boot camp, then you're going to see real downstream effects, because 25% of the military turns over every year, and if you can't train new recruits, then your military is going to degrade. And that's true of a lot of military skill training. It has to be done in person. There are some things, of course. there are some things that you can do remotely. You know, the war colleges you can teach remotely, but you can't teach military skills. I went through the artillery school many years ago, and you know, to gain those skills, you just have to be on the ground shooting at targets out in the impact area. You can't do it online.
Michael, what do you think as you're observing this and the biggest impact on the military right now?
Well, I agree with all the concerns that have been expressed, and Mark added some very important new ones. But I think overall, I also want to add a note of reassurance, which we've heard a couple this afternoon already, and I want to echo those. You know, this is a very serious thing that most of us have never seen the likes of, but it's also worth remembering that for the age demographics that are typical in the military, as well as the children of people in the military, we're talking about mortality rates probably well under 1%. Even for those who get the disease, and the duration of the disease can be multiple weeks, but it's typically, you know, for healthy people, perhaps a couple of weeks, at least if I'm understanding correctly the most recent medical information, which means that no adversary of the United States should think that they've got a window of vulnerability, that somehow the United States is incapable of deploying combat force if necessary to an acute security crisis. That doesn't answer the longer term problems, for example, that Mark just mentioned, which are similar to how do we get our kids back to school, you know, by fall, if not this spring. And we certainly can't miss too many phases of boot camp. But, you know, I think at some point we're going to start to accept a certain amount of risk. Most people view this coronavirus as something that's going to become endemic into the population. We're not really going to have a cure. We're not really trying, in a sense, to have a cure, in the sense that, you know, we don't think it's realistic. And for the most part, for the functioning of society writ large, it's not even necessary. And it's just the way viruses work. I don't want to sound callous, because a lot of people are going to die from this, but they're going to primarily be older people, primarily people not in good health, therefore primarily people not in the military today. And so I guess what I'm trying to do is to agree with every specific concern I've heard. This is a mess for everybody in the country, but to also take a step back and say that from a strategic and national security point of view, I don't really see a window of vulnerability, you know, of any meaningful magnitude arising for the United States. In fact, the kind of countries that would have a more meaningful vulnerability would probably be largely in the Middle East. Some of them are enemies, and most notably Iran. And we're not going to have the kind of problems, I don't believe, that Iran's had. So again, this is always the kind of message you feel nervous about conveying, because it risks sounding a little either callous or Pollyannish. I don't mean to be either. But when I think about the viability of our main combat formations to protect the country's interests, I don't see the likelihood of any major impact, or certainly not any prolonged major impact from this coronavirus crisis.
Yeah, let me jump
Thanks, Michael.
back in
Go ahead.
and make a point that reinforces something Michael said, which is that you have to make a distinction between sort of peacetime effects and wartime. And that is, in peacetime, we're seeing the exercises scale back, bases reducing activity. If there really were a conflict, for whatever reason, you know, many of these restrictions would be waived. We would deploy forces, we would deploy ships. You know, we would do our best to protect the service members, but we would accept the risk that goes with those deployments. So to agree with Michael and sort of elaborate on it, there isn't a window of vulnerability here in conflict, and potential adversaries should not believe that there is one.
Great. Well, and this topic came up earlier, but what do both of you see as the appropriate role for the military in a crisis like this? Because this is new, and I think as we've observed it, the DoD is still trying to figure out what its best functional role is, and a lot of people have ideas. What do both of you kind of see an appropriate role, and how far does that go until it starts to risk other components of the military? Michael, do you want to start with that?
Sure. I certainly believe that this is, in a way, a natural disaster or a biological disaster above and beyond what we see with hurricanes and such things. So certainly anything we would do in response to a hurricane, or that we might have done in response to 9/11, we could do here in terms of the number of guardsmen, guardswomen, other reservists who could be asked to carry out domestic functions. And so then it becomes, well, which functions are the most important, the most plausible? Certainly, Governor Cuomo's introduced an interesting idea of asking the Guard and the reserves, but also the Army Corps of Engineers to build extra hospital capacity quickly. I think that makes sense. There's the possibility of asking the military or the Guard in particular to help patrol streets where you have had lockdowns like San Francisco. I would prefer not to do that, and I hope it would be with a very friendly face and not with anything more than letting the police write the tickets. Just have the guardsmen be out there creating a sense of control and discipline and calm. But that's another possible mission if need be. And I don't really see a whole lot. One last one though, there are certain lower income communities where people have a dependency on food or other kinds of day-to-day provisions. Maybe that's being interrupted because kids aren't in school. You could imagine if it were simple tasks that didn't require specific technical expertise, that some of that could also be supplemented with military personnel, or again, guardsmen and guardswomen primarily. And so perhaps we'll see that kind of a conversation unfold, especially if some of the existing structures have a lot of attrition due to illness in their ranks. But, generally speaking, I think we can do those things. That's part of why we have a National Guard. My guess is that many people in the Guard would be honored and feel happy to do that sort of thing, even though it would be an encumbrance on their lives. It's, they joined the military for reasons of service, and to do something that helped out close to home is probably going to make some of them feel good about, why they're in the armed forces. So that's sort of the rough scale of what I would see coming, and I think it's eminently reasonable to expect that we would have a National Guard element in particular in response to the current crisis.
Yeah, Secretary Esper has been quite, not emphatic, but he's been making the point that the military is not the first line of defense here. It's really the third line of defense after communities and civilian organs of the federal government. There are things, as Michael said, that the military can do that would be useful. These are mostly support kinds of activities, logistics and whatnot. There are medical capabilities that could be brought to bear. One of the risks there, though, is that as you mobilize a unit in one community, that pulls out their medical professionals who are likely already involved with healthcare in that community, and then you move them to a different community. There's some light construction that you could do in connection with healthcare facilities. Building an actual hospital is impossible, but you could build a temporary facility outside an emergency room, for example, where you could do triage and expand some of your capabilities. I would expect a lot of this to come through the National Guard. As Michael says, they're tightly linked to the states. They're under the control of the governors. They can do law enforcement if necessary, unlike the federal forces, which are constrained by posse comitatus. The Guard does not like to do that. They prefer to have law enforcement officials deal with the citizenry on law enforcement issues. Frankly, soldiers make lousy policemen, and you really don't want them enforcing the laws if you can avoid it. So I would expect them to be in support roles, transportation, supply, that sort of thing, and avoiding actual law enforcement if that can be avoided. And in a situation like this, I don't think you're going to need to do very much of that. These aren't riots. People are getting sick. They aren't angry. So the kind of civil disturbances that we've seen occasionally in cities in the past, I don't think you're going to see.
Thanks, Mark. We're getting a couple good questions in, going back to the topic of readiness, and it seems like there's a lot of concerns of how this in the short and long term will impact readiness. And one of the audience members is raising the point that this has, our families are impacted significantly because kids are out of school, and that could cause issues. But then there's just the ability to carry out exercises. One person suggested here that virtual training and activities like that may be something that could be used. Is that all possible? And can that really prevent a readiness problem during this crisis that we really don't know how long it's going to last? Mark
Well,
or
I'll
Michael,
start.
you're either one. Yeah.
Well, Mark already commented, so let me say something, and then he can come back in and add whatever he'd like, because I think he made some very good points earlier. There are certain places in your development of military skills where you need to actually do it the real way on the ground. You know, it's hard to imagine a virtual replacement for boot camp. It's hard to imagine a virtual replacement for first learning how to fire artillery and get used to the noise and the toughness of the conditions, and do it in the rain and the cold. And you know, the same thing for flying planes. I mean, these are just the extreme examples. It's true for most, I think, military activities. But I think sustaining skills, it's a little more plausible that you could do that a little longer. You know, I mean, people in the military, you know, break their legs and have elective surgery and get sick all the time, and then they come back to the job they used to do, and 2 or 3 or 4 or 5, 6 months later, they can get recertified. So I think you have to distinguish between the 20 to 25% that, as Mark pointed out earlier, are just entering the military and learning skills for the first time. And I don't believe you're going to be able to simulate your way out of that problem for the most part. And then the people who already have pretty good skills, and to some extent, I don't want to say it's quite like riding a bike where you never forget once you've learned, but you know, they're going to be able to reclaim the level of proficiency more quickly once they return to normal training. So what this means to me is that as as this thing plays out over multiple months, it becomes more and more of a problem, because then you're going to have a higher fraction of your force that would have turned over, that would have needed to be replaced by rookie servicemen and women who might not be able to get the kind of training. And we're going to have to work hard at, addressing that by the summer or at latest the fall, making sure that we don't just shut down these core pipelines and developing basic skills completely. So I think, for a few weeks, it's not a big deal, but over the course of getting into the summer and fall, we're going to need some solutions to that problem.
Yeah, there are.
Mark, any thoughts on that?
Yeah, I mean, there are some things you can do with simulation, and as Michael and I have said, there are limitations. I think for exercises, you might see some that continue as command post exercises, where you don't actually have troops up there, but you stand up the various commands and get used to operating together and getting the communication set up, and getting the command and control exercise, particularly with allies and partners, and there's value in that, but it's a second best solution.
Great. Well, I think we're going to have to wrap it there because we're running out of time for our hour, but I want to thank both of you for joining us today and sharing your perspective. I think it did give us a good way to start framing some of these issues as we move through the crisis. So thank you again for joining us.
Pleasure.
Happy to be here.
Thank you.
I want to thank all of our speakers for joining us today and the great information they shared. This has been a great launch to our initiative, and I think we've identified some important topics that we will cover in the weeks to come. We've already made plans for our next town hall meeting on Tuesday, March 24th. That's next Tuesday at 3 p.m. Eastern. We're going to be specifically focusing on how this crisis is impacting our schools, our military impacted schools, and our children. And we'll be talking to superintendents, experts in the field, to look at how we can deal with a very immediate crisis that's happening around the country as public schools are shutting down and military families are trying to deal with that challenge. So look for more information on that event. Will be released tomorrow, and we'll be building out a little larger room so that we can fit everyone in for the next town hall meeting. I also want to remind you that their website is up and running. As Kathy said, it is a work in progress. We welcome you to share resources you might have. And as Kathy mentioned, we're going to do our best to take all the questions that folks have and figure out how we can either develop it into an FAQ or build it into future sessions. We are also working with our partners in DoD to get folks on a future town hall, and we hope to be announcing something in the coming week with our various components within DoD. I want to turn it back over to Kathy before we wrap. Kathy, any final words before we wrap up this first town hall?
Just a big thank you to you, Tim, and the folks at ADC and all my team at Blue Star Families who's worked so hard, and for the many partners on this call who are going to be doing so much to help us keep the whole community up to date. As we grow, we want to make sure that military families themselves are joining the call. I know we have many on today, which is great, and we want this resource to continue to work for our entire community. So thanks to all of you who've joined us today.
Thanks, Kathy, and thank you all for joining us today. We are glad you were able to be with us, and we hope you join us for future town hall meetings. Be safe, and we hope to have you joining us again next week. Thank you.